Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Today on the program, lawmakers ratify the 2019 national budget.
The Bicameral Conference Committee report on House Bill 8169 is approved.
Amid allegations of pork barrel insertions and questionable amendments.
Let me detail to you what I view as a pork-ridden, cholesterol-rich 2019 budget, particularly those lodged in the budget of the Department of Public Works and Highways.
Also, the Health Department intensifies its efforts to address the measles outbreak.
The preschoolers in those daycare centers must be given the full range of immunization.
And the fate of medical marijuana at the Senate. Senator JV Ejercito joins us live. And later be mesmerized with Istanbul, Turkey, the city that crosses 2 continents. That's for today's In Focus. Thank you for joining us. I'm Pinky Webb. After months of delay, Congress finally passed the proposed 2019 budget, but not without controversy. One of the voices against its passage says this year's budget is, quote, pork-ridden and cholesterol-rich, particularly those inserted in the Department of Public Works and Highways budget. Also, how can the government boost its immunization campaign amid a measles outbreak? Let's go straight to the source of the story. He's the Vice Chairman of the Senate Committee on Finance and Chairman of the Committee on Health, Senator JV Ejercito. Senator, welcome back to the show.
Yes, Pinky, good morning, and nice to be back here.
Good morning. Thank you for being here. So, the thing is, the budget has been passed, but there are obviously some senators who are very unhappy with it. Let me start with the Senate Minority Leader, Franklin Drilon. He says that the 3.7 billion budget is full of pork. Is it?
Well, unfortunately, there has been a lot of trading of barbs, accusations leading up to the approval. Finally, it has been approved, but there have been a lot of accusations being thrown by both houses. But it's really sad that it had to come to this. But Pinky, I would admit that I have made some significant insertions, quite big, 24 billion to be exact. But I can stand up for it because I know that it went to the Department of Health for the Health Facilities Enhancement Program and for Human Resource for Health, which are really needed. So that's why probably I think if you would look at the Senate insertions, there are a lot of big amounts, big funding, because these are all mostly institutional.
I think you had a lot of support, Senator, from your colleagues regarding the 24 billion institutional, that's what you call it, sir, institutional amendment to the 2019 budget. Why? Because it goes to what is called the HFEP, the Health Facilities Enhancement Program. Ano ho ba to, Senator?
Actually, the HFEP, or the Health Facilities Enhancement Program, since 2012, when we passed the sin taxes, it's a fund that is being used for the improvement of all government hospitals and health facilities all over the country. Because, Pinky, you know that the perception, if it's government hospital, it's old, it's dark, it's dilapidated, yung parang hindi ka na makakalabas ng buhay. So that has been the old perception of government hospitals. But lately, in the recent years, there have been a lot of improvement. Expansion, because our hospitals are already over capacity because of the growing population. Expansion, improvements, upgrade of equipment, these are all being charged to the Health Facilities Enhancement Program. So for 2019, the DBM wanted it to be a catch-up year because according to them, there have been a lot of slippages, delays, so they wanted it to be a catch-up year, so to speak. So kumbaga, there will be no HFEP budget for 2019.
Because yung 2018 na natira of savings of the Health Facilities Program, carry over dapat sa 2019. Is that correct? How much was that supposed to be?
That's 30 billion in 2018. But through the years, there have been slippages. So they want to, for all of these projects, parang auditing for 2019. But I vehemently protested and I really fought for this because as we are about to implement the Universal Healthcare Program this year, Pinky, I think it will be signed by the President anytime soon. We expect more patients, no? Coming to the health facilities, especially. And now, as it is right now, the government hospitals are over its capacity because of our growing population. So expansions are ongoing, rehabilitation, improvements, and I don't think it will be a good year for a catch-up year, so to speak, that we will be stopping all of these projects.
What does that mean, Senator? So you put in 24 billion. That's about 16 to 17 billion for the health facilities.
Yes.
And then there's about 7 billion for the salaries, correct,
Yes,
sir?
for the human resource for health.
Okay.
That's augmentation. Yes.
So yung 16 to 17 billion, sir, that is part of this year's budget, how much was the carryover from last year? So my question is, how much is supposed to be spent this year for the health facilities?
Actually, for this year, the proposal was done, no? I would like to thank my Senate colleagues, no? Even the minority, even Senator Drilon was the one who was really, pushed for this,
yeah.
no? So we really crossed party lines for this. For 2019, Pinky, dapat zero yan. It's 50 million only. It's really an auditing year. So, in other words, no new facilities or improvements will happen in 2019, which would really have bad effects, especially that we are about to implement the UHC.
Yeah.
So
how much is it for this year? Ito na yung total, 24 billion.
So instead of 30 billion, we had a compromise. We made it just half, no? Sabi ko ba, at least 16 billion. So that ongoing projects, Pinky, those are 70%, 80%, or even 100% will be completed, and we will be able to put equipment so that people will be able to get to use them already.
But see, that's where I wanted to understand the situation. How can there be no allotment for a 60, 70, 98% completion of a health facility this year if there was not going to be a budget?
Well, what will happen is all of these facilities that are ongoing since 2018 and earlier will be completed. But the problem, Pinky, is even if it's 100% complete, infrastructure is finished, but we cannot put equipment.
Okay, kasi wala ng pera doon.
Medical equipment and other things that are needed. So it will be a disservice, no? Because people will say, it's a white elephant. There's an infrastructure, but people cannot use it.
So, okay, very good. There is money now for 2019. You call this an institutional amendment, sir.
Yes.
Why is it an institutional amendment, and why is this not pork? How do you explain to the public that this is not pork, just to understand the situation?
Well, pork, the difference is that pork, it's already considered unconstitutional, supposedly, by the Supreme Court, because there is post-enactment intervention, meaning the lawmaker before, nakikialam, they have a hand on where to put it, which projects, even the contractors, no? That I would consider as pork. No? But in this case, this will be good because 16 billion, although there's infrastructure there's medical equipment, it's entirely the Department of Health who will implement the project now without any intervention from me.
You're not going to have a hand in this, sir.
No,
you won't be able to choose, hindi naman contractor, but distributor.
Which projects or which province.
Yon. Yeah. Okay, so that's done. I want to talk about the universal health care in a bit, sir. But again, it's the question that you have your co-senator saying that it's laden with pork. It's cholesterol rich. Is it, sir?
Which one? The budget?
2019 budget.
Well,
tanggalin na natin kasi inamin nyo naman, and it's all over, even in the paper, sir, that andun ka na nga, nag-insert ka talaga ng institutional amendment na 24 billion. Okay.
And I cannot speak for the others, no? But I
you
can only
studied
speak
this,
for myself.
Sir. You looked at this. Pinag-aralan nyo po.
But, well, I've been in Congress as well, no? And it's a different attitude because when I was there, I was only looking after my district. No? Whatever I can get, whatever I can insert, as long as my constituents will benefit, that's the attitude if you are in the House of Representatives. But in the Senate, probably, you look at the bigger picture, and probably we are more sensitive, I would say, to the pulse of the people, because being a national elected, we are. It's like being in an aquarium. So we are more sensitive to the pulse, no? So it's different.
Would you say, though, that there's a lot of pork in this budget?
Well, as what Senator Lacson said in his investigation, he saw a lot of probably last-minute insertions and lump sums. Anything that has, I would say, Pinky, those insertions that have no program of works or no details yet, I would consider that insertions that are last minute. And those are pork, I would think.
Those are pork.
I would
Did you
think
see
so.
those, sir? Let's be honest here.
I did not see the latter part, no? But as far as I'm concerned, in the budget that I defended, I made sure that there are program of works and other details that would come from the agencies themselves.
Are you saying, Senator, that in a way, is it fair to say that in a way you're more concerned about the kind of institutional amendments that you would put for the benefit of, let's say, the Department of Health?
Yes.
And pinapabayaan nyo na lang ho ba yung kung ano man yung amendment or insertion ng iba? Ganun
Probably
ba
as
yun?
Vice Chair, Pinky, I have my hands full in the last 2 or 3 budget seasons. I've been defending the DOTR, the DILG, the DOH, the housing, PCO, and others. No? So I have my hands full already defending all of these departments. No? In fact, information overload. But probably those senators, or other legislators that are not vice chair, probably they can scrutinize more, no? Because I don't think I will have the time to scrutinize other budgets, no?
But if you're saying that there is possibly pork in the budget, you said, because there are possibly last-minute insertions. Did you say there are possibly last insertions, sir, or there were last-minute insertions?
Well, sorry, I was not able to scrutinize anymore the other departments, because I was only concerned with the things that I was defending.
Such as the 26 billion or 24 billion
Yes,
for the health
course.
department.
And
Okay.
the infrastructure for the OTR.
But if there are questions, sir, I guess my question, this is what I want to find out. If you possibly even have doubts in your mind about this, why did you sign the budget?
Well, Pinky, it was really, as a vice chair, I think I have the duty, because it will all go to waste. So all of the things that we did, scrutinizing the budget, defending it, having the briefings, defending the programs. But Pinky, I was more scared of the economic implications, no, that having a reenacted budget would bring about. No? Because already in the first quarter, we are already delayed because we were not able to pass the budget last December. So all the infrastructure projects that are supposedly started, should have been started the first quarter, are already delayed. So our economy will really take a hit. Our GDP for sure will be affected in the first quarter. Now, Pinky, if we further delay, for example, and the election ban kicks in, that will be a bigger problem, because we cannot have any more projects until June. No? We have to finish the elections, and that will be 2 quarters that we cannot have infrastructure projects. And you know that the peak season for all infras are from January up to May. No? These are the summer months. So it will affect the jobs, inflation, GDP, everything.
So are you saying that you were just better off signing it than not?
Well, I would say that I was concerned with the implications, no, of having a reenacted budget, and at the same time, the effects on the economy. If the election ban kicks in, so that will be 2 quarters that we don't have a budget.
Just very briefly, the Senator Lacson is saying that each congressman was allotted about 160 million. Is this true, sir? I mean, from what you saw, meron ba?
Probably, Senator Lacson would have we call him as the legislator with eagle eyes. So,
do you believe him?
It has been his advocacy ever since. No? So, I cannot say that they have 160 million each, but...
You cannot say, or you don't want to say, sir?
We have parliamentary courtesy. And at the same time, Vicky, we just trust them, no? It's their insertions. It's their.
You said insertions.
Or not insertions.
Amendment.
It's their amendment. As long as it's line item, as long as we follow the process, as long as there's no post-enactment intervention,
You're
and
okay
I
with
think
that?
that will be okay, no? As long as it's done properly.
Okay, just as a last question on this topic before we go, what have you seen in the last years? Has there been more allotment or insertions now than ever before, sir?
Well, probably, Pinky, it's because we have a bigger budget now, no? It's already 3.7 trillion when in the past it's only 1 trillion, 2 trillion. Now it's 3.7. So that means more projects. And I would say that I'm hoping that we use it properly. No, I support the bill. No, you know, Pinky, how passionate I am with infrastructure, transport modernization. I know that this will stimulate economic growth. I hope that all legislators will use it properly. Wag naman yung what I see in, for example, here in our very own hometown. Not because I'm not in good terms with our congressman, but I mean, three layers of asphalt, school buildings that are being demolished so that you will build another school building, flood control projects in areas that have no history of flooding. So,
okay.
gamitin naman natin ng tama.
All right.
We trust you as elected members of Congress, but you have to make sure that it is spent wisely.
We'll be taking a break. This is The Source on CNN Philippines. Still to come, the Health Department's vaccination program and the fate of medical marijuana at the Senate. Senator JV Ejercito tells us more after the break. You're watching The Source on CNN Philippines. Our guest today, Senator JV Ejercito, sir, universal health care. When? Waiting na lang for the signature of the President. Okay.
It was transmitted last January 22, the ratified version of the Senate and the House to Malacanang. So by now, probably, Pinky, ongoing ang review by the Office of the President. I'm hoping that the President would sign it very soon, no? Because so that we can already start writing the implementing rules and regulations so that the people can benefit right away.
What can we expect from this?
Well, Pinky, it's an ambitious measure, I would say, but as the name suggests, it's giving access to good quality healthcare for all. So at least everybody will now be given assistance because all Filipinos will now be covered once signed into law. And
all, lahat.
Everybody, yes.
Ano ibig sabihin nun, Senator? Kapag pumunta sila sa ospital at may sakit sila, what does that mean?
That means that they can expect that they will be given assistance from PhilHealth. Not only the members at present, only PhilHealth members can avail of assistance. But now, even the 35 PhilHealth population, yung contributory, is about 35%. But what we included is the 65%. That's PWDs, senior citizens, and the poorest of the poor are the indigents. So,
hindi ba kasama ng senior citizens, sir?
By law. No,
yes,
it was already, but the
PhilHealth.
indigents, PWD. So, this is the one that we really look for. We try to look for funds, in source for funds to subsidize. So at least everybody will now have the opportunity to avail of assistance.
That means, sir, if anybody gets sick and they go to a government hospital, libre ho ba? Ganun na ho ba ibig sabihin? Hindi pa ako mag-IRR pa?
We wait for the IRR, but I think the indigents, senior citizens, PWDs, we can say that the basic services will be free. No, but because we have to be honest, Pinky, no, we are not yet a first world country.
Yeah.
We cannot afford yet to subsidize everything. So at present, Pinky, even with PhilHealth, PCSO, PAGCOR, other government LGUs that give assistance, according to studies, still 55% comes from out of the pocket expense.
Ng tao,
so
ng publiko.
what we want is to lower that to at least 30%, and that will be a big help already to our people.
But that means also, ano ho ba, kasama na ba dyan yung expanding the coverage of PhilHealth dito sa UHC?
Yes.
Kasama
Actually,
na
it's
po
an
yun.
enhancement of the PhilHealth law.
Okay.
So aside from increasing the benefits, covering all Filipinos, what we included, Sprinky, is also another salient feature is to strengthen the primary care or preventive side. No? Kasi before, parang it's all on the curative.
Yeah.
Kung kailan ka nagkasakit, doon ka lang makaka-avail. So what we want to do is to prevent, yung preventive, we want to strengthen so that it would not graduate anymore. No?
Ibig sabihin, you want to be able to have checkups for free for
Checkups,
Filipinos.
basic laboratory tests will now be included in the
Sana.
coverage.
But that's still, that needs to be talked about sa implementing rules and regulations to get the fine print really of what is included and excluded. Sir, the vaccination program right now, it is a problem. You know, way back, Secretary Duque was already calling help. You know, he was asking for help regarding this because of
Actually,
what happened.
earliest last year, he was already talking about this. And Pinky, even during the height of the Dengbaksha issue, during the heat of the issue, I was already, in fact, Pao Chief and I had a misunderstanding because I was also already worried, no, because of it might scare, no, because of the well, it's being sensationalized at that time. It might scare the parents, which unfortunately happened. No, I even said that we might have an epidemic or outbreaks. No, if parents continue to lose their confidence in the proven vaccines. For me, Pinky, I'm appealing to the parents to separate the issue of Dengbaksha against the proven vaccines because we will have bigger problems. No? Diphtheria, anti-polio, measles, TB. These are all proven vaccines and it will be better for them. Mas makakabuti kung bakunahan natin ating mga anak, no, sa mga napatunayang ng bakuna.
Senator Risa Ontiveros says this: her lies and hysterics, this is regarding Pao Chief Acosta, contributed to the erosion of public trust on the vaccination programs of the government. Do you agree? Yung ginawa ho ba, tatagalogin, ginawa ho ba na pagtulong supposed to be ni Pao Chief Persida Acosta dun sa mga Dengbaksha affected or victims, yun ho ba ang naging dahilan kung kaya't nawala ng kumpiyansa ang publiko sa ibang vaccination programs?
Well, Pinky, we cannot also blame Pao Chief, no, because it's really her job and responsibility to fight for those that are helpless, no, those that do not have money to pay for lawyers, no, those are really
Or for an autopsy.
yes,
Okay.
yes. So I think she was just doing her job. Kaya lang, I think she became, probably it's her delivery, yung sometimes it's her character, nag-hysterical siya, probably, it may have contributed, but I think
It may have.
It may have, but I think she was doing her job, defending all of the, I would say, the oppressed, no, those victims that do not have money to pay for legal assistance.
Do you think she went a little too far, though?
To each his own. Probably that's her way. Probably it's her character already. So
sabi ni Senator Risa Ontiveros is, you know, she's calling for the resignation. How would you react to that?
Well, we cannot force anybody to resign. It's her call, no? And
Would you support
would
calls
say,
for Pao Chief Persida Acosta to resign?
I think she did. She was just doing her job during that time, at the heat of the controversy.
The controversy,
So, and I think at least all of the past officials that were involved, the Senate Blue Ribbon Committee, for that matter, already recommended the filing of charges. Because I think, Pinky, in all of this, to summarize, I think the Dengbaksha could have been effective, no? But it should have gone through the protocols, no? As the world-renowned dengue expert, Dr. Scott Halstead said that there should be blood testing kasi problem yung zero negative, no, yung 10% of the population that do not have the virus.
So you don't, to summarize that, you do not join calls for her Pao Chief Acosta to resign. You don't support that.
It's her call, no, actually.
Do you support it?
I don't think you can force anybody. But I would say that she was just doing her job at that time. Probably overextended or probably, but it's her character. So.
Yun yung kanyang estilo. That's what you're saying. Sir, just very quickly, medical marijuana. What is the fate of that at the Senate, sir?
We already had our first hearing because the House already passed, no? At least if in case, we will just adopt, no? I am open to it because as Chairman of the Committee on Health, Pinky, if it will lessen the pain, if it will prolong the lives of those that are sick, no, especially those with epilepsy, cancer patients, if it can prevent seizures, why not, no? But again, I share the concern of Senate President Soto is really against this, really violently against this, his concern is the abuse, substance abuse. So he also has a point. So we really have to balance. So not until we are we are sure that there are safeguards, no, to prevent abuse, substance abuse, then probably the repercussions might even reverse.
Yeah. So, Senator, tomorrow is the start of the campaign season.
Yeah, tomorrow, hell will break loose tomorrow. So thank you. At least I will, for this opportunity, at least we were able to talk about some pressing issues before the political season starts.
Good luck, sir. Maraming salamat po sa inyo. Thank you to Senator JV Ejercito. This is The Source on CNN Philippines. Want to be in a city that crosses 2 continents? Find out on today's In Focus.